everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be doing things a little bit different and doing an extended review of a medication that we already covered in a previous episode. We covered Lorazepam in episode 8. So today we are going to be talking about Lorazepam. It has a brand name of Ativan. But before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Lorazepam is a benzodiazepine that's typically used for anti-anxiety treatment. So it treats anxiety. It's also used as a sedative, and it can be used as an anticonvulsant as well. It binds highly to the GABA benzodiazepine receptor complex without displacing GABA. Lorazepam binds to a specific site on the receptor and increases the affinity for GABA to its own receptor site. Enhancement of the inhibitory effects of GABA on neuronal excitation results by increased neuronal membrane permeability of chloride ions. It exerts tranquilizing action on the central nervous system without any strong effects on the respiratory system or the cardiovascular system. It binds to several sites in the central nervous system, including the limbic system and the reticular formation. In terms of indications for use, Lorazepam is used in the management of anxiety disorders, usually used for short-term treatment that is less than 4 months, to treat anxiety symptoms. It can also be used to treat anxiety associated with depressive symptoms. Sometimes insomnia is associated with anxiety or stress, and this medication can be used to treat that insomnia as well. It can be used as an anesthesia pre-medication to help relieve anxiety before a procedure, and it can also be used in the treatment of status epilepticus. Some off-label uses of Lorazepam would be alcohol withdrawal delirium. It's sometimes used with alcohol withdrawal syndrome in general. It can be used as an adjunct or breakthrough therapy to treat chemotherapy-related nausea and vomiting. It can be used for rapid tranquilization of an agitated patient. And we sometimes see it used for sedation in an ICU patient. Lorazepam or Ativan is classified as a controlled substance. This just means that there may be more rules and regulations associated with the dispensing of this medication when compared to other medications that are not classified as controlled substances. In Canada, it's available as an injection for solution in the strength of 2 milligrams per milliliter, as well as 4 milligrams per milliliter. It's available as an oral tablet. This would come in a strength of 0.5 milligrams, 1 milligram, as well as 2 milligrams. It's also available as a sublingual tablet that you would place under your tongue, have it dissolve in your mouth, and underneath your tongue, and your cheeks would actually absorb the medication. This is available as a 0.5, a 1 milligram, as well as a 2 milligram tablet as well. Before somebody was to use Lorazepam or Ativan, there are some contraindications that they must clear before they can use the medication. Lorazepam would be contraindicated in patients who have a hypersensitivity to Lorazepam itself or to any other components of the product. It would also be contraindicated in patients who have a hypersensitivity to other benzodiazepines, as cross-sensitivity may occur. It would be contraindicated in patients who have acute narrow-angled glaucoma. Severe respiratory insufficiency would also be a contraindication to using this medication. However, an exception to this contraindication would be during mechanical ventilation. Premature infants would not be able to use or be given Lorazepam. The injectable formulation would be contraindicated in patients who have sleep apnea syndrome. Injectable formulation would also be contraindicated for intra-arterial administration. This is because it may produce arteriospasm, which may result in gangrene. The last contraindication, which exists in Canada but not in the United States, is that it would be contraindicated in patients who have myasthenia gravis. Now, aside from the contraindications, which are reasons that the patient cannot use the medication, there are also some warnings and precautions that patients should really be made aware of before using the medication. It should be noted that benzodiazepines have been associated with anterograde amnesia. Patients should be made aware that these medications can cause CNS depression. This may impair a patient's physical and mental abilities or alertness, so they should be told to be cautious or to avoid doing things like operating heavy machinery or driving an automobile, things that require a lot of attention. Paradoxical reactions such as hyperactive behaviors or aggressive behaviors have been reported. The risk of these developing may be increased in adolescents or pediatric patients, as well as in geriatric patients. Patients with a history of alcohol use disorder may be at an increased risk of experiencing these. And finally, the risk may also be increased in patients who have personality or psychiatric disorders. Some hazardous sleep-related activities have been reported with the use of lorazepam, as well as other benzodiazepines, such as sleep driving, cooking while asleep, eating food, as well as making phone calls while sleeping. The risk of becoming dependent on these medications would be increased in patients who have a history of alcohol use disorder or drug abuse. This risk may also be increased in patients who have personality disorders. So in all of these settings, more stringent monitoring would be recommended. Patients may be more at a risk for tolerance, physiological dependence, and physical dependence if they use higher doses of the medication for a longer period of time. The risk of dependence is decreased if the medication is used for a short duration of time, for example, 2 to 4 weeks. The need for continued treatment should always be evaluated before the treatment period is extended by a physician. We should use this medication cautiously in patients who have hepatic impairment, insufficiency, or encephalopathy. Dose adjustments to a lower dose may be needed. There's a risk that it may worsen hepatic encephalopathy. And parenteral use, so the use of the injection form, would not be recommended in patients who have hepatic failure. Patients should be made aware that pre-existing depression may worsen during the course of therapy with a benzodiazepine. It's not really recommended to be used in primary depressive or psychotic disorders. And the medication should not be used in patients who are at risk of suicide unless there's also antidepressant medications in their regimen. We should use this medication cautiously in patients who have renal impairment, and the parenteral form is also not recommended to be used in patients who have renal failure. We'd want to use this medication cautiously in patients who have respiratory disorders, such as COPD or sleep apnea. This is because there's a risk that benzodiazepines may cause significant respiratory depression. We also want to use this medication cautiously in debilitated patients, so we'd always want to start off the medication at the lower end of the dosing range. Elderly patients may be at an increased risk of death while using lorazepam. The risk has been found to be the greatest in the first 4 months while treating an elderly patient with dementia. Lastly, we'd also want to use this medication cautiously in patients who are at an increased risk of experiencing falls. This is because benzodiazepines have been associated with an increased risk of falls as well as traumatic injuries. There's also a black box warning associated with lorazepam or Ativan coming out of the United States, so I'm just going to read this verbatim here now. Concomitant use of benzodiazepines and opioids may result in profound sedation, respiratory depression, coma, and death. Reserve concomitant prescribing of these drugs for the use in patients for whom alternative treatment options are inadequate. Limit dosage and durations to a minimum required. Follow patients for signs and symptoms of respiratory depression and sedation. In patients already receiving opioid analgesics, prescribe a lower initial dose of lorazepam than indicated in the absence of an opioid and titrate based on clinical response. If an opioid is initiated in a patient already taking lorazepam, prescribe at a lower initial dose of the opioid and titrate based on clinical response. I should also note here that this medication is a high alert medication. So the Institute of Safe Medication Practices, or ISMP, includes this medication in its IV formulation among its list of drugs which have a heightened risk of causing significant patient harm when used in error. Now, once somebody is cleared of all the contraindications, made aware of the precautions and warnings, and they start to use lorazepam, as I mentioned before, it's available as an injectable solution and tablets, but they can most likely expect to receive their dose in tablet form. When somebody is using the tablets to treat their anxiety, they would typically use 2 or 3 milligrams daily. Their dosing would be divided up throughout the day into 2 or 3 doses. The usual dosing range after initiation of the medication is complete would be 2 to 6 milligrams daily, again, given in divided doses. However, it should be noted that the dose range could range from 1 to 10 milligrams daily. If somebody is using the oral tablets to treat their insomnia associated with anxiety or stress, and they're below the age of 65, they could typically use 0.5 milligrams or 2 milligrams at bedtime. But if the patient is above the age of 65, they would use 0.5 to 1 milligram at bedtime. If somebody is using lorazepam as a pre-medication for anesthesia before a surgical procedure, they would want to be given 0.05 milligrams per kilogram. They would do this 2 hours prior to the surgery, and the maximum dose would be 4 milligrams. For the sublingual tablets, the dosing would be very similar in this setting. They would still want to use 0.05 milligrams per kilogram. However, they can use their dose 1 or 2 hours before the surgery. The maximum dose would still be 4 milligrams. If somebody is using this medication for the off-label use of alcohol withdrawal delirium, they can use 1 or 4 milligrams of the injectable formulation, this time given intramuscularly, every 30 to 60 minutes. And it can be given every hour after this to maintain a light level of somnolence. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Lorazepam or Ativan, so I'll go over most of those here now. Drowsiness and sedation seem to happen over 10% of the time. Pain at the injection site is seen between 1 and 17% of the time with the intramuscular formulation, and about 2% of the time when it's given intravenously. Paradoxical reactions that we discussed in the precautions and warnings also happen greater than 10% of the time. Hypotension or low blood pressure comes in below 2%. Dizziness happens about 7% of the time, and unsteadiness happens about 3% of the time. Hallucinations are seen in 1% of patients using Lorazepam. Coma, confusion, delirium, depression, as well as excessive crying, headache, and finally restlessness all come in at a percentage below 1%. Redness at the injection site happens about 2% of the time. About 2% of patients experience respiratory failure. 1% may experience difficulty breathing. And less than 1% may experience hypoventilation. The more side effects where the frequency is not defined are as follows: disinhibition or disorientation, drug dependence as well as euphoria, extrapyramidal reactions, hypothermia, fatigue, memory impairment, sleep apnea, slurred speech, suicidal ideation, suicidal tendencies, vertigo, and withdrawal syndrome. All of the medications that I just listed would be central nervous system adverse reactions. In terms of dermatological reactions, alopecia or a rash may present. In terms of endocrine and metabolic side effects, there may be a change in libido, hyponatremia or increase in lactate dehydrogenase. Moving on to gastrointestinal side effects, there may be a change in appetite, and constipation may also present. In the genitourinary system, there may be impotence, and there could also be orgasm disturbances. Hematologically, leukopenia as well as agranulocytosis may occur. In terms of hepatic side effects, there may be an increase in serum bilirubin, increase in serum transaminases, as well as jaundice. Hypersensitivity reactions may occur, such as anaphylaxis, and some patients may experience visual disturbances. In terms of respiratory side effects, some patients may have an exacerbation of their chronic obstructive pulmonary disease, or COPD, and others may experience respiratory depression. That's all we're going to talk about today with this extended review of Lorazepam or Ativan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.